Hello, I'm Dr. Michael Ches. I'm a pediatric epileptologist from the Sacramento, California region, and I'm here to talk to you today on behalf of the Lennox-Gastaut Foundation on medication called Felbamate. Felbamate is a dicarbamate class agent. It is a type of drug compound that was developed in the 1990s and had been approved for partial seizures with or without secondary generalization for adults, and then used in childhood in different types of epilepsies, and was tested and approved by the FDA for Lennox-Gastaut Syndrome. The patients who were on Felbamate often benefited from the studies that were performed for approval, but the Felbamate had a bad rap that developed late in the 1990s because of a aplastic anemia or liver failure risk that became apparent in approximately 1 in 30,000 patients. However, none of the cases occurred in anyone who was under the age of 15 without other comorbidity, which included prior chemotherapy or autoimmune disease, and was mostly seen in Europe and in adults. However, because of that, it's used not as a first-line choice, but after you've failed other medicines, or if you've been on other medicines that have not been successful for Lennox-Gastaut, is the most common time your doctor may recommend it. The patient side effect risk for Felbamate can be mild. Otherwise, it can have a little bit of appetite suppression. If you take it late in the night, some people have insomnia from it. But overall, it's a fairly well-tolerated medicine without a lot of weight gain, without a lot of other fatigue or side effects for most people. The mechanism of action for Felbamate may act as a modulator of the GABA A receptors. It may block NMDA glutamate receptors, and it basically can inhibit metabolism of other drugs. So if you're taking other drugs that are metabolized by the CYP2C19 liver enzymes, such as phenytoin, valproic acid, or carbamazepine, you may need to check levels and adjust those agents lower, or use the Felbamate to bump those levels up a little bit if it's beneficial. Obviously, in Lennox-Gastaut, we don't use much phenytoin or carbamazepine. So it's a dual mechanism of action, like I said. It works on the NMDA receptors for glutamate as well as GABA receptors. And so it has a little bit of a broad action and works on both generalized and focal seizures, and has been beneficial for drop attacks that we see in Lennox-Gastaut, more so than the atypical absence seizures. So tonic, atonic seizures would be the ones that would be beneficial from Felbamate. Levels are recommended in a month after starting the drug and every 3 to 6 months after that, just to watch the liver and the hematological risks. However, as I said, in most patients, no one under 15 has been reported having a complication to Felbamate without other comorbidities such as prior chemotherapy or other autoimmune disease. So it's still a good choice for Lennox-Gastaut and may play a role in patients who suffer from Lennox-Gastaut if your doctor feels it's appropriate. Thank you for listening. I hope this was helpful to understand what Felbamate, also a trade name Felbamate, is known for.